A nationwide mental health crisis is impacting communities all over the country, including the Mid-State.
You know, this is a problem that can have deadly consequences.
Our Holly Thompson sheds light on a disturbing new study showing the mental health of our children here in Tennessee and how one state program is trying to answer our youth's call for help.
You need that, and you need it to be highlighted as well.
Jennifer Williams teaches English at Holloway High School in Murfreesboro.
What source was that? Okay, if you'll highlight the whole thing.
Working with seniors and freshmen for the last 23 years.
They're in class, they're engaged in the class, they're engaged in the lesson, and they're engaged with one another.
But Williams says that wasn't always the case. Years ago, schools dealt differently with students' disruptive behavior, withdrawal, excessive fears, and other symptoms of mental health problems. The difference now?
Y'all having good days?
Williams says Corey Thompson is the difference. Thompson is a mental health professional called a school-based behavioral health liaison who focuses on counseling, assessments, intervention, and developing coping strategies with parental approval.
They're having to come to school and present this facade that everything's okay when sometimes at home things are not. People are struggling. There's not always food on the table. Parents are losing jobs, and transportation's not always reliable.
Ever increasing social media consumption and exposure to traumatic events, Thompson says, add to students' mental struggles. New data released in Centerstone's 2025 Youth Mental Health Report shows 1 in 5 Tennessee high schoolers reported having significant anxiety or depression. 1 in 5 Tennessee high school students has also seriously considered attempting suicide. Thompson says kids need a safe space.
When they come in and they realize I am really just here for them with zero expectations, they can come in and be themselves, and the good, the bad, the ugly, and it stays in this office, and we're just here to help them be more successful.
Thompson is one of 390 behavioral health liaisons assigned to schools across the state, funded by the Department of Mental Health and Substance Abuse Services, who partners with 13 community health centers.
Our goal is to have a school-based liaison in each of the public schools across the state. There's well over 1,900 public schools across Tennessee, including charter schools.
That goal, Deputy Commissioner Matt Yancey says, means adding more than 1,500 school-based liaisons.
Can Tennessee do that?
Tennessee can absolutely do it. I firmly believe we can get there. This is a goal that's important to our department, primarily because we know it's a service that children need.
The additional hires would come with a hefty price tag. Yancey says at least an additional $100 million would be needed.
Having more counselors in each of these schools means better academic outcomes. It would also mean safer, healthier school environments and school climates. That's the ultimate benefit.
I asked Deputy Commissioner Yancey how much their budget will increase for this program this next year. He said, stay tuned. The governor's budget hearings are now underway. And if you're unsure about the status of the Behavioral Health Liaison program at your child's school, I'll have a link in this story for more information. It's on our WSMV4 app. Holly Thompson, WSMV4.